Second. Looks like we just have minutes for the December 18th and December 10th meetings. Any discussion on that? All in favor signify by saying aye.
Aye.
Okay, motion carried. Okay. First on our scheduled sessions, we have Jenna Lemrick, Human Resources Director, and Matt Wine, Planning Director. This is a discussion only, and this is an update on the mass vaccination clinic. Matt, do you want to get us started? Yes. Jenna, whichever.
So I have a couple of points that I wanted to make sure I go over with everyone. And then, Marilyn, I do have paperwork for you.
Thank you very much.
You're welcome.
No, we're going to take that off.
So the Board of Health has approved our mass prophylaxis manual that happened at their last meeting on November 13th, 2020. That manual lays out the internal policies and protocols for us running a vaccination clinic as public health. It also establishes a number of job roles and what their expectations are of those jobs, and helps us ensure that we're compliant with federal and state requirements on that. What we did once we laid out the clinic, which I handed you this document here, which is the layout of our largest clinic that we will run. This will be held down at the Mid-America Center. Out of this clinic, we know that we can process through 200 individuals per hour at a full capacity running it. That takes approximately 60 staff members to be able to do that. Obviously, we don't have that kind of staff with the public health department, and so we reached out to all of our other county departments and asked who would be able to assist us with this part of it. And we did get a number of individuals that signed on because we knew we had people working here who were either EMTs or had some sort of health background. And we created the job roles under the fact that you don't necessarily need to have a health background. Really, the people that we needed for that were our vaccinators. That's the nursing staff. We're also working with a couple of pharmacists, and we'll have pharmacy interns that'll be there available to dispense vaccines to individuals as well. And so we have gone through our online trainings with those individuals. We also then held tabletop drills with individuals who are going to be here at this clinic as well. So part of what we wanted to make sure that the board was aware of today was that those are county employees that will be down there working with us. And FEMA has put out their guidelines that we are able to submit for reimbursement to having those people down there helping us. But it does come at a cost to us as the county. And when we look at what the cost of running a vaccination clinic would be, is we are looking at a potential of 18 pods. And so I'll refer to it as what it should be. A pod is a point of dispensing. So as you hear from the state or through public health, that's what you'll hear a vaccination clinic referred to as, is a pod. And so we will be looking at running approximately 18 pods. A full running pod costs us around $21,000 per day in staff time. Now that's if we're fully staffed. That's if we have the 60 individuals down there running. Not all of these pods will be fully staffed. In the beginning, like what we're looking at for phase 1A, and as we talk about the different phases, Department of Public Health did issue their vaccine shortage order. On the bottom of page 1, it describes out phase 1A of those individuals who will be first up to receive the vaccine. It's healthcare personnel. They refer to them as HCPs, and then also long-term care facility residents and staff. And in the long-term care facilities, they're not only going with the skilled nursing facilities, but they're also going with your assisted living programs, elder group homes, residential care facilities. So you have those individuals that are all figured into phase 1A. We did get that first allocation in the IRIS system. Through the IRIS system, public health's role on that is to just approve who those allocations go to. We've done that by surveying all of our different healthcare providers and finding out what their staff numbers are, what they would like as a request for that first allocation, and then